Hi there, so I'll be presenting my research poster to you on exploring length-tension relationships using hand grip dynamometry and EMG in whole muscle. Some background on the subject is that surface EMG is widely used to measure action potentials of muscle, and the hand grip dynamometer is the most common tool used to assess grip strength, and it does so in kilograms. The muscle force is affected by joint position-induced sarcomere length. So I want to see if this translates to whole muscle. And the purpose and hypothesis is, does the length tension relationship apply to whole muscle? And our hypothesis is that our resting length at the wrist generated more force than flexed or extended positions. So this is how it applies to whole muscle. And there's a lovely image of a muscle and its different components. So here's some information on our subjects and with the inclusion and exclusion criteria. However, we'll go right along to the methods and discuss about how our subject was set up for the experiment. So here's information on the electrode placement and how the arm was positioned. And there is a picture of a lovely subject with a hand grip dynamometer. And so to our data, we analyzed it using the percent EMG and percent standard force compared to the maximum voluntary contraction using the mean and standard deviation. So our table here shows the standard at the top and then the various readings in relation to it. So that the standard was the standard position. And one thing of example that's of interest is for the short hand grip position, the flexors were showing a higher reading on EMG, so it resulted in a lower force than the standard position, so that just indicates that the EMG does not equal force. So on the bar graph there, we have our standard on the left, which was compared to, for each position, the EMG and the force achieved. And we can see that the force was lower in all positions out of the standard position. So that goes to our discussion, was that the force is low at all positions outside of resting length, and the EMG readings do not represent muscle force. The length-tension relationship is valid in whole muscle, and our results support the literature that neutral wrist position results in the greatest grip force. And our hypothesis was proved, or was supported because the resting length resulted in the greatest force production. So this has clinical relevance that these standardized positions can be utilized to ensure maximum muscle contraction and optimal patient outcomes, and the greater muscle efficiency can reduce overuse disorders. And the hand grip dynamometer is practical for measuring maximum grip force. So just to touch back real quick, the standard deviation was somewhat large because we had a variability of our patients, but with a bigger sample size that could have been lowered.